Ladies and gentlemen, welcome to this audio slide presentation. I'm Robert Gunsberg, and I will discuss our article recently published in Clinical Biomechanics entitled A New Approach to Prevent Contralateral Hip Fracture, Evaluation of the Effectiveness of a Fracture-Preventing Implant. The tested device consists of two interlocking PEEK polymer rods. It is cannulated and contains many holes to allow cement injection and cement flow and distribution into the bone. First, numerical tests were performed to identify the best position for the implant inside the bone, in the center of the femoral neck or in the upper third part of the femoral neck. Fracture risk was assessed for each position and for a non-instrumented femur model in two configurations, single stance and lateral force simulations. On the second hand, we performed biomechanical tests to evaluate the efficiency of the device to improve the biomechanical performance of the proximal femur. Side impact testing was performed on 6 pairs of femurs with low bone mineral density. One femur of each pair was randomly assigned for implantation. The contralateral femur served as an intra-individual control. The device was combined with a mean amount of cement of 7.8 cc. The testing setup characteristics have been mostly described in the literature for simulations of a fall in the greater trochanter. The specimens were loaded with a constant speed of 100 mm per second to be representative of a low-energy fall. Cyclic loading was also performed on an instrumented femur. The contralateral non-instrumented femur was first loaded until fracture. The instrumented femur was loaded to this fracture load for 30 cycles and then loaded until fracture. The numerical simulations showed the lowest fracture risk was associated with the implant in the upper third part of the femoral neck, whatever the single stance or the sideways fall configurations were considered. This placement was used for the implantations for the biomechanical tests. These tests showed the potential reinforcement of the femoral bone with Y-STRUT, since the risk factor was reduced by up to 28% in case of axial compressive load and up to 52% in case of a trochanteric load of a femur implanted with the device. Through the biomechanical tests, the measurements showed that the insertion of the implant increased by 18% the fracture load of the implanted femurs in comparison with the contralateral controls. We also observed an energy to fracture increasing by 32%. Besides, the failure modes observed showed that the type of fracture is unchanged between the specimens with and without implant. Regarding the cycling testing, the instrumented femur resisted the implementation of the non-instrumented femur fracture load for 30 cycles and kept its performance at the end of the cyclic loading with an increase of 22% of the fracture load. The number of 30 cycles corresponds to the 30 falls which can occur in elderly in a period of 10 to 30 years, according to Lord and co-workers. This study demonstrates the potential of Y-STRUT to improve the biomechanical performance of the proximal femur in sideways fall configuration. It is to be noted that no subtrochanteric fracture and no fracture occurred at the entry points of the implant. Besides, the amount of cement used is minimal compared to femoroplasty techniques, allowing to limit the exothermic reaction that may cause necrosis of the surrounding bone cells. Moreover, the device and cement removal is easy to perform if need be. Finally, we showed that implant insertion seems to be relevant to support multiple falls and thus to prevent a second hip fracture in elderly patients.